So I will turn it over to Sherrie, who's doing some fantastic, like I said, we were really happy to get her steal her from Harvard and have her come down here.
Thank you, Dick. Okay, and all I know about HPV, I've learned from Dick. Okay, we'll go ahead and get started. Okay, I'm going to talk about a little bit about what I get questions about almost every day. Some from journalists, mostly from parents, and some physicians, is about the HPV barriers. And Stephen, I think it was before you went on your tour, he asked Dick, was he ready for all, really just the hostility toward this? And I always tell parents, I try to meet them where they are. And there are still a lot of parents that are very hostile toward this, very ambivalent about it. And I think primarily it rests with the fact that just really in the United States, and even outside the United States, very many people are not aware of HPV. And so when you look at the research surveys done across the country, where parents, college students even, adult men and women, very few knew what HPV was. And I think what's really scary to me still in 2014, when many people hear the term human papillomavirus or HPV, they confuse it with AIDS, HIV, and also herpes simplex virus. And so what I've started to do in my work with communities, parents, I've started to educate them on what the difference is, because they're all viruses, but they do very different things in the body, don't they? Okay, so some of my research focuses on educating parents and adolescents to sort of improve that knowledge gap, work with health providers so that they can give a strong referral. And I'll talk about why providers are so important. And it wasn't till I came here that I was talking with Dick one day, and he just sort of casually said, we really got to reach the providers. And he was right, because the research now speaks very strongly to the fact that a lot of providers don't support the vaccine, and that they look at it differently than other recommended childhood vaccinations. So we want to help providers to make that shift, and also help providers to identify missed opportunities for HPV vaccination, support implementation of HPV reminder recall, which that speaks to Dick's last comment about the fact that this is a 3-dose vaccine. In many countries, as well as the United States, that's considered a barrier, because it's hard to get adolescents sometimes to come in for 1, and then when you asking them to come in for 2 and 3, especially when you're working with minority and underserved populations, the 3-dose has been identified, the fact that it's a barrier as well. And then provide appropriate care and counsel for patients and their families. Okay, so just a little bit. Now you will see this a lot in the media. Some of you have probably written about HPV infections. Many of them are asymptomatic, so most people will probably never get symptoms. And then many times the virus will clear up on its own. But what we don't know is what are the factors that will cause it to clear up in one person and lead to chronic infections, or hopefully not cancer. And so certainly HPV is linked to warts, RRP, which Dick talked about earlier, then cervical cancer, and now the last area where we're seeing a lot of research and reports about it linked to anal, vaginal, vulval, penile, and head and neck cancer. Okay, now some of my work focuses on looking at disparities, HPV disparities, and this slide always puzzles me, because primarily what we see is that among Black and Hispanic women, they have some of the highest rates of HPV-associated cancers. And then this really disappoints me, the fact that we're in the nation's capital and that the District of Columbia has one of the highest rates of cervical cancer. And then when I look at the U.S. Census data, we know that in the District of Columbia, it's primarily in the southeast quadrant of the city, known as Ward 8. The District of Columbia is split into 8 wards or neighborhoods. And we look at southeast, and it's really troubling because the cancer rates as well as other health conditions are really high. But that relates to a lot of social, structural, I would say, issues related to transportation, access. That area has a lot of food deserts even, and so all of these things, sometimes we have to look beyond cancer and look at those other social structural issues that may be impacting these rates. Okay, so one question I got this question while you all were visiting the labs, is about the safety. Now, this is just a little bit, but the Center for Disease Control and Prevention always refer parents to their 1-800 number, which you can actually get a live person, and they monitor all of the reports about HPV. But it's important to remember that when I'm talking to parents who are especially upset about this vaccine, is one, as I said, I keep saying this is a cancer prevention vaccine, and if we had a prostate cancer vaccine or a breast cancer vaccine, I really think that people would be lined up around the door. And so we need to really embrace the fact that this is a cancer prevention vaccine, and I, for one, am very proud of that. But 57 million doses of the HPV vaccine have been distributed from 2006 to 2013. And a lot of the common side effects are similar to other vaccines. And I always share this when I'm talking to parents. When I went to Harvard, you know, if you have kids, you can't step foot on any college campus without your shot record. Well, I'm from North Carolina, the youngest of 5, and my mom could not find mine. And she said, Sherrie, after 5 kids, I was tired. I don't know where yours is. And so what happens if you can't find it? You have to take them all over again. And I had to take the MMR, and I had a classic textbook reaction. But I tell people, even though I had arthritic pain, rash, that did not make me, you say all vaccines are bad, but we have to consider that in the United States, we do have a strong anti-vaccine sentiment. And so when I'm talking with people, that's the lens that I have to keep in mind. And that's why I said earlier, it's important to meet people where you are, because that will get you further than when people just say, this is a terrible vaccine, you're just testing this on our girls, Big Pharma is just pushing this. Every argument I have heard. Okay, all right. So the vaccine is very safe, but there are some side effects similar to other vaccines like soreness, dizziness, and that's why when we're talking with providers, we make sure that they understand that once the shot is given in the arm, that they are nurse to sit there with the patient, because if there's some dizziness or fainting, you don't want them to fall off the table, of course. Okay, now let's talk about rates. When the vaccine was first approved, it just sort of had a dismal launch, didn't it? It was only about 25% of the girls in the United States had received the vaccine. And this was really disappointing in states like Ohio and in Kentucky, where you see the rates of cervical cancer so very, very high. Okay, so now that it's been out a while, the marketing around Gardasil and Cervarix are the 2 vaccines. And I will say that Cervarix has been around a lot longer. It was first introduced in European countries. And Gardasil is very important because, as many of you know, Gardasil is the only vaccine that's approved for males. And a lot of people get that mixed up because they think they could give Cervarix, but only Gardasil is approved for males. And so right now, if you look at the U.S. national rates, we're getting better for the first dose, but still not where we need to be. And people ask me, Sherrie, where do we need to be? Well, that's set by the U.S. Health and Human Services, and they set targets for all vaccinations, and the target is 80%. So right now, there is not one state in the U.S. that's at 80%, but we're climbing. So you can see for the first dose, the U.S. national rates is about 57.3 for the first dose. And for District of Columbia, believe it or not, and I've checked this out like so many times with CDC, because sometimes the DC Department of Health, you know, they don't always get favorable reviews. But in working with them, I've checked. So you check the source. Like when I was in journalism class, my journalism teacher said, Sherrie, you have to check 3 sources. So I took that to heart. And with these statistics and numbers, I made sure that I checked 3 different places. And DC is pretty good. So greater than 2, you see for females, it's about 47.7%, and for District of Columbia, 43%. And that 3 or greater. Now, this is a problem, we know, but what happens, the reason, because I say, how can you have 3 or greater? Because there are only like 3 shots. And so what happens is, in many states, you have patients, they may go to perhaps a health clinic to get 1 shot, or they may have a private physician. We have a lot of populations that are very transient. And what happens is a patient's medical record or immunization record does not always follow with them, or people's memory may not be that good. And a parent may say, oh, I don't think my daughter had that shot. And then you find out later, after you were able to get it, that they've had, 4 shots, which scientifically and clinically, it doesn't cause any problem, but the tracking, and so that's why you see that greater than 3. Then let's look at males. The males, again, the target is 80%. So we're not so surprised that the rates are low for males because it was just recently introduced. But we do see the national rate is 34, and again, the District of Columbia's rate is really high for males. Now, a couple of reasons behind that in talking with people. One, Whitman Walker is a clinic here in DC. They treat a lot of AIDS, HIV patients, and they have a huge LGBT population. And the DC Department of Health has really partnered with them to talk about HPV and to do education. And then also in the District of Columbia, we have what? We have an HPV mandate, and that mandate says that girls going into the 6th grade have to receive the vaccine or they can opt out. Now, last month, that legislation just received an application for an amendment to now include boys. And so what happens with the legislation, once they put that out there, it immediately comes effective through an emergency order, but then they have to send the legislation out for what? Public comments. So in the next couple of months, you can watch and hear that DC again will be in the news probably, because when they rolled it out for girls, there was a lot of hostility, there were protests. Okay, so people were really upset about it. And I think in talking with David Catania, who is the councilman that pushed for this legislation, just a little bit of background, his mother died of ovarian cancer, and he really wanted to make sure that everyone in the district who wanted to take advantage of this cancer prevention vaccine could get the vaccine for free. And when states pass legislation, part of that legislation can include that districts and states have to then provide resources for adolescent girls and now boys to get the vaccine for free, and that's through a program called the Vaccine for Children's program, and that covers all childhood immunizations for girls and boys up to the age of 18. So for males, you see for 2 doses it's around 40, and for 3 it's only about 24. So the big key issues, or I would say, as my journalism teacher taught me, well, what are the key message points? And they would have to be around HPV completion, because many girls and boys are getting the first dose, but they're not getting the second and third dose. So I'm going to go really quickly. So here are some of my friends, and they're going to help me talk about roadblocks. Okay, so in looking at all of the research that's come out, I would say in the last 6 years, these are what I would say the common things are. Lack of knowledge, like a lot of people don't know what HPV is. Health literacy. Sometimes by the time you say human papillomavirus, you've lost people. Okay? Efficacy, how safe is it? It hasn't been out long enough. Okay, concern about appropriateness. The vaccine is approved for girls and boys starting at 9. And sometimes I get people yelling at me, why would they approve this for someone so young? Okay, and here's why. Because, and I encourage people to look at this through the CDC. It's called the Youth Behavioral Risk Survey. It's almost scary at the types of risky behaviors that our young people are engaging in. And one of the things that it has shown over the last 10 years is that our young people are engaging in sex at such an early age. And we know that through the clinical trials that this vaccine is most appropriate, effective if it's given before young girls and young boys have their sexual debut. So that's one reason why it was approved for as young as 9.
Isn't there also a stronger antibody response?
Right, I was getting ready to say that. Very good. You get an A++. Okay, a stronger antibody response. Very good. Okay, now cost was an issue before the Affordable Care Act. Cost was an issue because a lot of populations did not have insurance. And then even though the Vaccine for Children program was in place, a lot of parents didn't know they were eligible for it. Okay, and then HPV mandates. DC has an HPV mandate, and also one other state close by, Virginia. And we have to watch Virginia because right now Virginia is currently trying to repeal theirs. Okay, and then this last one, sexual promiscuity. I talk to parents every day, and they just says, if you give our kids this vaccine, you're just opening a door for them to have sex. And I say, but that's not what's causing them to want to have sex. It's those raging hormones. So there are other broader conversations that impact this, like parent-child communication about whether or not they're comfortable or not comfortable, because one parent said, you're forcing us, parents, to have this conversation before we're ready. Well, you know what, folks? Whether we as parents do it or not, our kids are going on the internet, and they're telling me in my adolescent interventions that they're having these conversations whether or not their parents want them to have it with them or not. Okay, so sexual promiscuity, and just the fact that some people just feel like age 9 is too young. So here are all the states, about 41 states have passed legislation. Now part of that legislation is that money has to be provided, or education has to be provided. Okay. Okay, and this is a little bit about the legislation. I encourage parents to actually read that, pull it out. Okay, now, here's what I think one of the biggest barriers is. For good or bad, sometimes the media can do marvelous things in helping us to educate about scientific discoveries and informations. And sometimes the headlines are just scary. The great HPV hoax exposed, and this one, a little girl, it just upset her so bad because she had gotten the HPV vaccine, and she saw this one and she was so upset. And it says, it's official, 139 girls have died from the HPV vaccine. Now this group here, there's a group in DC, I think they've disbanded, it called No HPV Shots for Me. Okay, so all of these headlines, and these are headlines, a student of mine is doing a content analysis of headlines for newspapers and pulling those. Then we have celebrities that have gotten involved, like Farrah Fawcett, who was diagnosed with anal cancer. And then this question, I've gotten that twice. Why does my son need a vaccine? He does not have a cervix. I'm like, okay, let's see, where do I start? Okay, so that shows the lack of knowledge awareness with some parents. They think this is just something that women can get. And part of that had to do with the vaccine was first approved for females with the end outcome of cervical cancer. So now when you talk to especially people in other countries like the UK, where their rates are about 90%, we really should have given some thought about approving it for both girls and boys in the beginning. Because a lot of the gaps are that this is something that women only get, and that men can't get it, and they can't transmit the virus to women, and vice versa. Okay. And Michael Douglas, who could forget Michael Douglas and all the faux pas he started? I'm sure his wife was very mad at him. Okay. Then Katie Couric, did any of you see that interview? Where then she had to backtrack and talk about how unbalanced the reporting is? Okay. And then some of the things we're doing, here are some of all the types of ways that I work with parents, some of the methods that I use, and then focusing on providers. When we talk about providers, we talk about not just pediatrician, family medicine docs, nurse practitioners, school nurses, parents, and adolescents. Okay. Doctors are the number one predictor of HPV uptake and completion. So whether or not a doctor actually says this vaccine is something your child should get today, that's the number one predictor whether or not parents will get it. Okay, and I'm just going to go through, and we put together a training where we trained providers. And I just did a webinar with the American Association of Pediatricians where we're doing this training, and they could get 1 credit CEU. So those are some of the ways we're trying to reach them. And these are some of the trainings we did. And then working with partnerships. And I've developed this toolkit, and I've gotten so many requests from other states for it, where providers can have this toolkit right there at the resources. I put all the materials on a jump drive so that they can share them electronically with their colleagues. Okay, and then I would just say, when you're talking or writing about HPV, some of the things that we've learned is that it's important to frame the communication and discussion around cancer prevention rather than sexually transmitted virus. That's a huge debate now. So you got the sexually transmitted disease folks, then you got the cancer prevention folks. But I find that when you frame it in the term of cancer prevention, that really opens up the conversation, especially with parents. Discuss HPV vaccine as you would other recommended vaccinations. So a lot of pediatricians say, don't say this as a provider. Here are the vaccines that your child will need today, and then, oh, there's that other thing, that HPV. Because automatically, that's going to make the parent think, maybe I don't need to get this. Use gender-neutral messages. So don't just say this vaccine is just for girls. Say that this vaccine, this virus impacts both boys and girls, so people don't think it's just for females. Give a strong HPV vaccine referral, and then also this speaks to meeting people where they are. You have to realize there are cultural, religious, and linguistic barriers that may prevent people from understanding what the vaccine is. Okay, and then these are questions that I get, and we're going to provide copies of the slides because our time is running out. But we did some focus groups with Hispanic moms and daughters to try to address that issue of the high rates in DC. And it was just clear as day. The parents had just such a low knowledge gap. What scared me was a lot of the Hispanic moms thought HPV was linked to breast cancer, and they said, we don't believe you. We don't believe that it's linked to cervical. We think it's linked to breast. And that's interesting because a couple of years ago in the New England Journal of Medicine, there was one study that showed that some of the breast tissue had HPV, but those studies have found out not to be no correlation. Okay, the daughters, Some daughters describe the shots as painful, so they didn't go back. So these are some of the barriers. And then the media stories, if they heard something on the radio, they felt like that, they didn't want to get it. Okay. And then we have a communication campaign that I worked on with the DC Department of Health using some of these media outlets. And here's some of the social media and media things that we did. So these campaigns are running on the Metro, the buses, also on Comcast, and that's also one of the things DC just never did. They never did a HPV campaign when they passed the legislation. Okay, and here's some of my other research studies, and I'll stop there just in case you have some questions because it's around 12:15 now.
So what is that age parents needs to be start talking with your pediatrician for that?
Well, most pediatricians consistently will bring it up if their child comes in and they're around 9. They'll start talking with the parent about HPV. Now, what may happen, a couple of things may happen. They may say yes. They may say, I think my daughter is maybe a little bit too young, maybe later, and then when the daughter gets 12 or 13, they come back and they get it. Or they just say no altogether. So if you're in the District of Columbia, you can opt out for no reason, okay? So you just have to fill out a form and then you send it back to the school or school nurse. And in DC, as you know, there are several school-based health clinics. And then also Georgetown, we're fortunate enough, we have the kids mobile van who goes to the schools, selected schools, and they would do HPV and all immunizations. And recently I was talking to them, and their request for males getting it has really gone up. Yes,
I wanted to know if you had any knowledge of how other new vaccines in the past have been received by the public. Is this like an unprecedented hostility toward this vaccine, or in the past have other new vaccines also been met with?
I think, as I said earlier, Dick could comment, in the United States, we have a strong anti-vaccine sentiment with all the research that was done, or fake research that was done by Dr. Wakefield, who really put that out there, that vaccine caused autism. And so now we know that a lot of that research was rescinded and not true. And so I think the broader conversation is around anti-vaccine sentiment just in general. But I think that when you educate people, and people are really receptive to learning, and I just tell people, don't believe me, I give them the resources where they can go and call or check out this information about questions that they have. But I would say this one is different. We don't know why people perceive it differently. I think because this is a sexually transmitted virus, but I think it's hepatitis B that's given to babies. Okay, that's a sexually transmitted virus as well, but we don't get that pushback like we do. And I just really think that with the mandates, it was too much too soon, you know, because parents felt like, okay, you're really trying to force us to do this. But a lot of the parents said they would want to have a conversation, you know, and the rollout could have been better. And I've talked with the DC Department of Health, which is why they've since come back and decided to do this public awareness campaign. So really, I think if you want people buy-in, you've got to have them at the table and part of the conversation. And I think parents were really not part of the earlier conversations.
Thank you. I'm sorry. We've got a bus waiting outside. So
Yes, but you have my contact information.
No, we
Please
don't.
contact me.
We don't have your
No?
email.
Oh, okay. Okay.